Do you have high blood pressure and want to explore natural ways to manage it? You've come to the right place. Today, I'm going to share simple, effective ways to bring down your blood pressure without relying on medication. Stick around, we have a bonus tip at the end. A quick disclaimer: while these tips are based on scientific studies, always talk to your doctor before making any changes to your health routine. First, let's quickly acknowledge the power of medications. If you're already taking them, they do work, and they can be a lifesaver for many. But today, we're focusing on alternative ways to manage high blood pressure naturally. Let's dive into 10 practical tips that could help you lower those numbers without medication. Number 1. Exercise, the miracle worker. I like to think of exercise as nature's miracle drug. Regular physical activity is a game changer when it comes to lowering blood pressure. Studies suggest that 30 to 60 minutes of moderate exercise, 5 days a week, can reduce your systolic blood pressure up to 6 mmHg. Number 2. Maintain a healthy weight. Lose weight, or at least avoid gaining. It's no secret that weight plays a big role in blood pressure. Even losing just a few pounds can make a noticeable difference. Some research suggests that for every 2.2 pounds, or 1 kilogram lost, your blood pressure could drop by about 1 mmHg. And if losing weight seems tough, simply maintaining your current weight is a victory in itself. Number 3. Quit smoking. Every time you light up, your blood pressure spikes by up to 20 mmHg for about 20 minutes. Imagine what happens if you smoke multiple times a day. Not only does smoking harm your heart and lungs, but it also keeps your blood pressure elevated throughout the day. Quitting smoking is one of the best things you can do for your health. Number 4. Cut the salt. A lot of people have salt-sensitive hypertension, meaning that reducing sodium in their diet can have a big impact on blood pressure. Try to aim for less than 2,300 milligrams of sodium per day, and if you can, reduce it even further. Cooking at home helps you control how much salt is in your meals. Number 5. Boost potassium intake. Eat more potassium-rich foods like sweet potatoes, spinach, bananas, and tomatoes. Potassium helps balance out the effects of sodium and reduces tension in blood vessels. Just make sure to talk to your doctor if you have kidney issues before increasing potassium intake. Number 6. Stress less. Chronic stress can contribute to high blood pressure, so finding ways to relax and unwind is crucial. Deep breathing exercises, meditation, or even just taking time for hobbies can lower your stress levels and, in turn, help your blood pressure. Number 7. Limit alcohol intake. While a glass of wine here and there is fine, excessive drinking raises blood pressure. Stick to moderate drinking. That's up to 1 drink a day for women and 2 for men. Number 8. Enjoy more omega-3 fats. Omega-3 are heart-healthy fats that help reduce inflammation and can improve blood pressure. You can find them in fatty fish like salmon, chia seeds, flax seeds, and walnuts. Number 9. Drink herbal teas. Teas like hibiscus and green tea have been shown to help lower blood pressure. Try replacing your afternoon coffee with a cup of herbal tea to give your heart a little break. Number 10. Get enough sleep. Lack of sleep increases your risk of high blood pressure. Aim for 7 to 9 hours of quality sleep each night. Create a relaxing bedtime routine to help you wind down and give your body the rest it needs. Bonus tip: low levels of vitamin D can cause elevated blood pressure. Get your blood work checked if this may be a problem. A good source of vitamin D is getting outside and enjoying the sunlight, but based on your levels, you may need to get a supplement. So there you have it. 10 natural ways to lower your blood pressure. Remember, small changes can lead to big results. Thanks for watching. Don't forget to subscribe, share, and like this video if you found it helpful. And let me know in the comments which tip you'll try first. See you next time.